Hello everyone, I am Dr. Rohan Khandelwal and I head the Department of Breast Surgery at CK Birla Hospital, Gurgaon. Today I'll be talking about oncoplasty. Now this term has gained a lot of popularity in the last few years, and as the term suggests, it's a combination of two terms. Oncological surgery, that means cancer surgery, and plastic surgery principles, and when we combine both of them, they help us in achieving a better cosmetic outcome in patients who have been posted for breast conservation surgery. So the first aspect is the oncological aspect. So we never compromise on the margin status. Our oncological clearance should be complete. And you know that these days the margin status, there are various definitions. Some people like to follow no tumor at ink, whereas some people are comfortable with a 1 millimeter margin as well. Now, once you've done the resection or the lumpectomy, depending on the amount of defect which you have, if you've removed less than 15% of the breast tissue, then we do what is known as volume displacement. That means we mobilize the breast pillars and we close them. We don't add tissue from outside. That is volume displacement. Volume replacement is when we've removed more than 15 to 20% of breast tissue and we augment it by getting tissue from somewhere else. That is volume replacement. So these are two terms which are commonly used in oncoplasty. There is one more grading of oncoplasty. You can have level 1, level 2 and level 3 oncoplasties. Now level 1 oncoplasty is a basic closure of a lumpectomy defect where you do dual plane undermining, right? Where you mobilize the breast pillars from the skin and from the pectoral fascia, and then you mobilize these pillars and you close them. That is simple level 1 oncoplasty. Level 2 oncoplasty is the one which is most frequently done. Level 2 oncoplasty is when we do nipple centralization and de-epithelialization of the skin to ensure that the nipple is centrally placed, it is not riding up or going laterally. So the commonly used techniques for level 2 oncoplasty are round block technique or the Benelli's technique, which I would say is the workhorse for any oncoplastic surgeon. And the other ones are hemi-batwing, batwing oncoplasties as well, which fall under level 2. Level 3 oncoplasty is when we do mammoplasties or reductions using either the Weiss pattern or the lateral mammoplasty technique, and that falls under level 3. In level 3, we can also do contralateral symmetrization where we ensure that both the breasts are of the same volume and the nipple is also at the same level. Unfortunately, in India, not a lot of patients opt for contralateral procedures. So these are the two definitions for oncoplasty. I've told you about volume displacement and replacement, and I've told you about the 3 levels of oncoplasty which any general surgeon or breast surgeon should be aware of. If you have any further queries regarding these techniques, please do write them in the comment section and I'll be happy to answer them.